Governor Sununu, the vast majority of pandemic deaths in New Hampshire have occurred in long-term care facilities. Is it fair to say that you and the public health team should have moved more quickly to deal with that? And why is it that despite significant lockdowns and tight rules, the deaths continue to come at those long-term care facilities?
So let's look at the real data. Is that the deaths, unfortunately, let's understand, one is too many, right? And through this entire pandemic, whether you're in a long-term care facility or it's a loved one fatality is too many. But in terms of the number of fatalities we've had in long-term care compared to the beds we have in our population, we're one of the lowest numbers on the East Coast. I think that we are the lowest in New England. We had a series of outbreaks. I think we've talked about 20 plus outbreaks. That's back down to a handful of outbreaks. We have very few fatalities in the general community, right? So the ratio of fatalities in our long-term care was much higher because we had so little transmission and transmission that resulted in a fatal rate. So I think Commissioner Shibinette has done a phenomenal job. Her background was running long-term care facilities. She's an operator. I think her and the Department of Public Health did a great job identifying the issue. We're one of the most aggressive states in the country with sentinel testing, one of the most aggressive states in the country of providing PPE, all those tools and resources, and that's exactly why the numbers have dropped so precipitously in long-term care.
Thank you. And Senator Feltus, you allege that the governor reacted too slowly to the pandemic. But as cases of COVID-19 were beginning to build in New Hampshire, as the Senate Majority Leader, you pushed to convene the legislature for 2 long days. As to why the Senate needed to be in session while much else was closing, you said, quote, "I think the executive branch and the legislature have taken a different perspective so far, but we're going to continue to monitor the situation." How do your words and actions then square with your criticism now?
Well, we suspended activities roughly when everyone else did. And on nursing homes, let's be clear, societies are judged by the way they treat their most vulnerable. Our children, folks in nursing homes, long-term care facilities. And it took over a month and a half to go out to get a contract to do testing in some of the facilities of some of the workers from Chris Sununu. It went out to a no-bid contract to a corporate campaign donor of Chris Sununu. And look, we have to move forward on this. We have, as ranked by the New York Times, the worst COVID situation in long-term care. And we have legislation to support long-term care with PPE, with testing and financial support, and to do an independent audit of what happened in long-term care. Chris Sununu vetoed it. It was bipartisan legislation to do an independent audit and plan for a second wave. Now we got outbreaks all across New Hampshire in nursing home. And lastly, the most important thing here is making sure we protect and strengthen Obamacare, because if we don't, our nursing homes and assisted living facilities will get in much worse condition.
Next question, you were invoked, Governor, go ahead.
To be fair, Senator Feltus brought a bill on June 30th, months after the pandemic had started. They had been gone. They went home. The legislature threw up their hands and they went home. And my team jumped in and we took action very aggressively here in New Hampshire, which is why we have one of the lowest fatality rates in long-term care on the East Coast.
That's not true.
And that's absolutely true. When we talk about an audit in long-term care facilities, for weeks we had our press conferences where we talked about how we were going through, looking at exactly what had happened, looking at airflow and how the dynamics of the virus were moving through that facility. So we took very aggressive action, which is why 20 outbreaks became 2 very, very quickly.
And we have more outbreaks right now because there was not the kind of analysis and independent review to determine what to do moving forward. And if that bill had been signed, our nursing homes and our assisted living facilities would have been stood up. Now we got healthcare facilities that are in the red. And we have, in fact, Lakes Region General Hospital has filed bankruptcy today. And there's this CARES Act relief fund that the governor took unilateral control over, could have stabilized our healthcare system, didn't, could have stabilized nursing homes and assisted living facilities, didn't, and gave out a whole bunch of money to corporations. And I want to ask everybody at home, $1.25 billion that Chris Sununu gave out, how much did you and your family get out of that $1.25 billion? I bet you didn't get any.
Okay, let's be fair about the $1.25 billion. We're the only state in the country that put out over half that money to businesses, to employees, to the self-employed, to nonprofits. We put more out in relief efforts than any state in the country, more than Florida, New York, California. That was an amazing opportunity that we put out for those individuals. And when it came to the legislature's attempt at the $1.25 billion, they sued me. They tried to slow it up in court. They tried to slow it up with government bureaucracy. I was cutting deals on the phone for PPE, for testing, on a moment's notice in those early days. And we did a phenomenal job doing that. In fact, we became one of the best states in the country bringing in PPE because we had the flexibility with that CARES Act money. And everything we've done is 100% transparent. You can go on the website now, see where every dollar has gone. Right? Transparency is the foundation of public trust, which is why I've been constantly out there, whether it's press conferences or taking messages right here on WMUR on a Spurs notice. Again, we're trying to just be as open. It's one thing to say we're all in it together. It's another thing to actually do it. And we knew very early on we were going to be incredibly transparent through this whole process. So there's nothing behind closed doors. We just moved very, very quickly, and we were not going to let bureaucracy hold up what otherwise was opportunity in the middle of a pandemic.
Well, look, everybody believes in transparency. It's just that this hasn't been transparent. In fact, vetoing legislation to do an independent audit and review of what went wrong is the epitome of not being transparent. And giving out no bid contracts to corporate campaign donors and giving out CARES Act relief money. You know, over 200 corporations got $350,000 of that CARES Act money. Small businesses got very little. And I bet you if you're sitting at home, you didn't get any of Chris Sununu's $1.25 billion.
Only small businesses got those dollars. Only small businesses could qualify.
Businesses with $20 million a year in annual revenue. That's what you set up.
Or less. Yes, that's a small business.
$20 million a year is a small.
Yes,
that's
actually a fraction of how the federal government defines a small business. And those hundreds of thousands of dollars have saved jobs and businesses. Do you know we have less business closures this year than we did last year? Because they could pay their property taxes, they could pay their bills, they could pay their employees, stand up their businesses through the toughest of times.
That's not what
and
I'm
we're more
hearing
successful
from
here in New Hampshire.
Across the state.
Our economy is stronger here in New Hampshire than anywhere else on the East Coast, and I take a lot of pride in that.
You know what? 1/2 of New Hampshire's children live in working poor households right now. Last year at this time, there were 775,000 folks in the labor market in New Hampshire. Right now, 735,000.
And 4% unemployment. That's a miracle.
20,000 folks
That's a miracle.
are detached from the labor market because of lack of access to childcare. And we're going to stand up here and pat ourselves on the back. You know what? We got to move forward together. Lift up working families and working people. Strengthen and protect Obamacare. Work for people on the ground in our small businesses.
We want to move on. 15 seconds, Governor, to respond.
I'll just say on the child care issue, the Democrats put a bill to have $10 million of CARES Act money go to child care. I put in $25 million in the beginning, and we put in another 10 last week. We put in more dollars to child care than they even wanted to do, and we did it faster with better results.